from Healing Hands Clinic, Pune. Today we will be discussing new modality of treatment for benign prostatic hyperplasia, what we commonly call as BPH, that is enlargement of a prostate. This treatment is called UROLIFT, and it has been, I would say, at least 1 year since it has been launched in India. And Healing Hands Clinic is the first center across Western India to start doing this procedure. The procedure is very simple, and it is mainly for treating patients who are having chronic urinary problems in terms of difficulty in passing urine, going for urination more frequently at night, straining while passing urine, then not feeling that the urine is completely emptied, and there is a thin stream of urine. This treatment basically involves putting some staplers inside the prostate so that the urethra, which is occluded by the prostate, opens up and the patient is able to pass urine freely. Here at Healing Hands Clinic, we are doing as a daycare procedure where the patient comes in the morning, we do the procedure. It takes hardly 15 to 20 minutes under some form of sedation, and we don't need to give a complete anesthesia also. And patient stays here for 5 to 6 hours, and then in the evening the patient goes home. We tend to keep urinary catheter for such patients, and the patients are quite comfortable because they don't need to carry any tubes, and on the same day the patient can go home, and from next day onwards patient can start working. The important part in this procedure is that those patients who are very weak, frail, contraindication for any forms of prostate cancer treatment definitely will be benefited from such procedures.